much. Dr. Anthony Fauci and other U.S. health officials now saying the U.S. is seeing spikes in cases as immunity from vaccines decreases. Are booster shots the way out of the pandemic? Joining us now to discuss, cardiologist Dr. EvanLevine, also author of the book, What Your Doctor Won't or Can't Tell You. Doctor, thanks for joining us today. Good morning to you.
Thank you, Emma.
Absolutely. All right. There's a lot of data suggesting that there are upticks across the country when it comes to COVID cases. Now, of course, that's not the same as COVID fatalities, and we know that to be true. But now Dr. Fauci is making the rounds on cable news channels, and he's talking about when we might need to learn to live with this pandemic and accept it as a way of life. Watch this.
We are now at 70 to 75,000 cases a day and over 1,000 deaths. That is an unacceptable point to say we've got to live with it. Absolutely. If you get it way down below that, well below 10,000 a day, that may be something that we can ultimately live with.
Okay, so he's got his warning there. But doctor, talk to me about how we can live with this virus in your best recommendation.
Well, I agree with Dr. Fauci that the numbers are way too high. As far as getting a booster, I'm a healthcare worker. I did get a booster. The other thing is, when we talk about boosters, you know, should we all get them at the same time so we don't have this waxing and waning effect? It's like if I ask people to get a flu vaccine in July, by the time the flu season occurred, they wouldn't be immune. One of the things that troubles me is we're letting in undocumented migrants. We're not vaccinating them. And then we're transporting them all around the country. No one discusses that with Dr. Fauci, but that's spreading COVID-19 101. There are so many ways to diminish the spread, but we have to be fair and talk about everything.
Sure, absolutely. 1.7 million migrants, CBP numbers reporting that so far. We don't know their vaccination status or whether or not they would be carrying coronavirus. You mentioned the flu as well, the flu vaccine, timing for it. Here's what Dr. Fauci had to say about the flu. Watch this.
The difference between influenza and COVID-19 is that we don't have a very good vaccine against influenza. So we cannot accept a high level of deaths to COVID-19 when we have a vaccine that could prevent it.
I mean, there are flu shots every year, too. What do you think of his analysis of the flu shot, the flu vaccine, and how it compares to the COVID vaccine?
Well, the efficacy of the flu vaccine is roughly about 50%. So the newly vaccinated folks, if they have a Pfizer or Moderna vaccination, the efficacy is far greater. And also the severity of illness is obviously far greater with COVID-19. The flu is something that we've lived with for years. Obviously, the severity can vary from year to year, but he is correct when he says that the vaccination success rate, especially with the messenger RNA vaccines, is far greater than our success rate with flu vaccination.
Although we have learned that it has decreased as the time progresses, and perhaps that's why people are signing up to get their booster shots. Here's what former FDA Commissioner Dr. Scott Gottlieb had to say about that.
We have to look at the immunity in terms of not just how many people have been vaccinated, but also the depth of immunity. How many people have a lot of residual immune protection against this virus and are going to be what we call a dead-end host and not going to be someone who can catch and spread this virus. And the fastest way to turn someone into a dead-end host is to get them fully vaccinated. There's a lot of people with declining vaccine effectiveness right now who can both catch and spread this virus. If we give them a booster, we restore the full effectiveness of that vaccine. The other way, unfortunately, is to get immunity into the population quickly is to get people infected. And unfortunately, that's the way a lot of people are choosing to do this.
Doctor, your final thoughts on those comments?
Well, I agree, as I mentioned, that if we have this, everything is spread out and we have people getting vaccinated a year before others, the immunity wanes, and that's a problem. So we need to get a large population of people completely immune, and to do that, we need to roll out the boosters like Dr. Gottlieb suggested faster. Yes.
Okay. Well, again, there FDA approved for that Pfizer vaccine right now. So you can check that out where you got your first 2 doses if you're looking for a third. Dr. Evan Levine joining us on the program. Doctor, thank you very much.
Thank you.